Good day. Thank you very much for joining us in this session. The talk is about eating by the clock, meal timing strategies for weight loss and health. I'm Dr. Bien Matawaran. I'm an endocrinologist. These are my disclosures. And for this session, my objectives are to provide an overview of meal timing strategies and other regimens for weight loss and health. We'll also try to discuss physiologic mechanisms by which these strategies might lead to improved health outcomes, and I'll try to present the evidence on the health benefits of meal timing strategies. So the talk or the discussion will not include other dietary key concepts like fat diets and ketogenic diet. Adjustments of meal size and frequency have emerged as powerful tools to lose weight as well as to ameliorate and postpone the onset of diseases and even delay aging. So these interventions may either be characterized by alteration in caloric intake or alteration in meal timing. In particular, alteration in meal timing or periods of fasting with or without reduced energy intake can have profound health benefits. And the underlying physiological processes involve periodic shifts of metabolic fuel sources, promotion of repair mechanisms, and the optimization of energy utilization for cellular and organismal health. To put things in perspective, this slide shows you the patterns of daily and weekly food consumption. So the upper illustration in circles actually shows you different patterns of food consumption during a 24-hour period, as represented by the illustration letter A. So this is the usual eating pattern wherein you have 3 large meals interspersed with snacks in between. And this seems to be the common eating pattern or food consumption upon which the epidemic of obesity and diabetes and associated chronic diseases has emerged. So this is pattern letter A. Pattern letters B, C, and D are actually examples of time-restricted feeding or TRF or time-restricted eating patterns wherein there's a window during wakefulness, a window or a time during wakefulness that you'll be eating your regular meals, so sometimes 3 times a day, as represented by B, or 2 regular meals, as represented by C, or 3 smaller meals, as represented by circle letter D. So there is just a particular window for you to eat those meals. Or there are also daily food patterns wherein you have total complete fast, as represented by letter E. The illustration here on the lower right part of the slide actually represents, on the other hand, examples of weekly eating schedules. As you can see here, the common diet is represented by letter A, wherein you have in a week regular meals 3 times a day with snacks. So TRF or time-restricted feeding is represented by letter B, okay, item B, and the 5-2 diet is characterized by times wherein you have letter D, meaning small meals 2 days in a week, and time-restricted feeding, okay, or a window for eating is represented by B, small meals, in the rest of the week. There are also alternate day fasting wherein you have regular meals, interspersed with fasting periods. Like this is a regular and then fasting, regular and then fasting. Or you have the alternate day energy restriction. So you have regular meal and you have letter D again with this pattern in a week. Okay, so these are just some of the examples of daily and weekly food consumption. Okay, so dietary regimens with variations in meal size, frequency, and circadian timing are considered in this or types are pulled into 3 categories. Okay, so one is caloric restriction, time-restricted feeding, and intermittent energy restriction. So basically, caloric restriction is defined as daily caloric intake reduction by as much as 20 to 40%, and meal frequency is unchanged. So you basically lower caloric intake, but the frequency in the meal timing is unchanged. Time-restricted feeding, on the other hand, involves limiting daily intake of food and caloric beverage to a 4 to 6 hour time window. So there's not exactly any restriction in the caloric intake, but the restriction is in the timing. So for a 4 to 6 hour time window. So that's why it's called a time-restricted feeding. While intermittent energy restriction involves eliminating or greatly reducing by as low as 500 calories per day intake of food and beverage intermittently. For example, 2 days in a week. So we sometimes call intermittent energy restriction as intermittent fasting. So this is just to show you, again, terminology. So you see here caloric restriction, time-restricted feeding, intermittent or periodic fasting, and fasting mimicking diet or FMD. So as you can see here, caloric restriction is daily reduction by 15 to 40% of caloric intake without malnutrition. So you basically have macronutrient distributions, less for 55% for carbohydrates, 30% for fat, and 50% for protein. But you lower the total caloric requirement by as much as 15 to 40%. So feeding time may not change, and there are studies showing increases in lifespan for mammals as well as for rodents, and the effects on health as prevention of obesity, diabetes, and oxidative stress. Time-restricted feeding is there's daily food consumption within the 4 to 12-hour window as represented by this, okay? The standard diet may be altered, okay? But again, there's only a small window for feeding as represented by orange for time-restricted feeding, okay? Intermittent or periodic fasting is there's alteration of 24-hour fasting, alternation or very low calories. So you may have a standard diet, but again, you may have days of feeding as represented by orange or days of complete fasting as represented by green. And of course, fasting mimicking diet, there's reduced caloric intake for 5 consecutive days before returning to normal eating cycles of FMD once a month or every 3 to 4 months per year. Okay, so these are just again to illustrate to you the differences in terminologies with regards to these variations in caloric intake as well as meal timing. And both this total intake reduction, where we have caloric restriction, or changes in the exposure of food, be it TRF, IF, or PF, there seems to be data to show that there is improvement with regards to brain response, cardiovascular, pancreatic response, adipose tissue response, effects in the skeletal muscle, intestines, in the liver, and the blood. So it's very important, particularly for meal timing, time-restricted feeding, and intermittent fasting, that we review processes, particularly the mammalian circadian system. We are well aware that light or phototic signals are very important, when it stimulates the master clock, which is located in the suprachiasmatic nucleus in the hypothalamus. As you can see here, light is a very important stimulus, for the clock, for the master clock to actually function. And there are, based on the circadian signal from the master clock, there may be effects through signal integration in the peripheral clocks, meaning particular organs, the brain, the heart, the pancreas, the gastrointestinal tract may have their own peripheral clocks that will eventually have particular oscillations with rhythmic synchronization with the suprachiasmatic nucleus. So again, light and wakefulness is very important in circadian variation. This is to illustrate that the integration of circadian rhythm and feeding fatigue cycles with metabolism is likewise important. As represented here, as I've said, light is very important because light is associated with feeding, while darkness is associated with fasting. And as you can see, feeding may be driven by hunger, dependent on energy intake, diet composition, and the length of fasting that will affect several processes downstream that will affect health and survival. As you can see also, as I've said, light is associated more for anabolism, while darkness and fasting with catabolism. Okay? So The illustration on the right, on the other hand, okay, as you can see here, so these are graphs trying to represent what we call the RERs. No, it's represented in the y-axis, or the respiratory exchange ratio, which is the ratio between the volume of CO2 being produced by the body and the amount of oxygen being consumed. So basically, a normal RER is between 0.7 to 1. Okay, 0.7 to 1. So that anytime you have RERs below 7 or 7 and below, it means that the predominant fuel that is being utilized is fat, okay, while values more than 1 will tell you that the predominant fuel source are carbohydrates. So the values in between will tell you that there's a suggestion of a mix, both fat and carbohydrate catabolism. So as you can see here, ad libitum, so you have a mixture, but in caloric restriction, you will see that fat is much utilized. So there will be more lipolysis. Similarly, in time-restricted eating, you look at the RER, you also see that during times of fasting, there is more utilization of fatty acids or lipolysis. And similarly, if you have feeding days and fasting days, you see that it's represented by the green, or the fasting days, there is more fat oxidation or utilization. And similar with fasting modified diet. So that shows you that really with fasting, together with the circadian rhythm, there is more catabolism or breakdown of fat. So that is why this is the hypothesis why there is some benefit with regards to weight loss, no, in changing meal timing. So as you can see here, as again represented by those illustrations, wakefulness and feeding is associated mostly with anabolism, while sleeping and fasting is characterized by catabolic pathways, lipid catabolism, glucagon secretion, glycogenolysis, and oxidative metabolism. So this shows us, okay, what physiologic mechanisms happen during wakefulness and feeding versus sleeping and fasting. So initially, early morning at around 6 o'clock, you expect these physiologic changes, normal physiologic changes, rise in blood pressure, secretion of melatonin stop, you have high testosterone secretion, highest risk for myocardial infarction during the morning, greater muscular and cardiovascular strength in the afternoon, and highest blood pressure before sunrise. Okay, so you also see that at night, there is melatonin secretion starts, and this is where, okay, potentiation of insulin secretion may occur. You have deep sleep, no, and highest probability of that very early in the morning. And this is driven by circadian rhythm. And basically, the role of the circadian clock in regulating nutritional and energetic balance is very important. So this summarizes the effect of timing or circadian rhythm with regards to metabolic function, with regards to molecular oscillations of neurotransmitters, hormones, and enzymes, and coordinated response of the peripheral clocks. So again, we have to remember that aside from photic signals, there are also non-photic signals like feeding, temperature and sounds, and social timing that may regulate your circadian system, particularly the master clock and even the peripheral clock, so that if there's no disruption, as you can see, you have the regular physiologic functions, sleep-wake cycle, body temperature, blood pressure, blood glucose, heart rate, etc. However, if there is disrupted circadian homeostasis, this is where diseases might occur. Okay? So let's now particularly look at time-restricted feeding. So time-restricted feeding, again, is defined as limiting daily intake of food and caloric beverages to a 4 to 6 hour time period. Again, if we look at feeding patterns, eating over an extended window of time in a frequent change in daily eating window, you will see the higher, as represented by green, you see the higher number of obesity, cardiometabolic diseases, changes in sleep quality, as well as changes in quality of life. However, for time-restricted eating, you see a reduction in obesity, cardiometabolic diseases, and better sleep and quality of life. So basically, the beneficial effects of time-restricted eating pattern is that there is more lipid mobilization versus lipid storage, wherein you use glycogen stores and you induce lipolysis, thus producing these effects, no? Changes in body weight, a reduction in body weight, fat mass, blood glucose, etc. All seems to be beneficial with time-restricted eating or feeding. So this is just a bird's eye view of the benefit or the proposed pervasive benefits of time-restricted feeding for brain health. No, it counters fatty liver, maintains gut integrity, blocks white adipose cell hypertrophy, and prevents brown adipose tissue whitening. It reduces heart aging and preserves muscle fitness. So these are the pervasive benefits of time-restricted feeding. And these benefits have been noted or favorably noted in both animal models, rodents, and Drosophila, as well as in humans. So as you can see here, this is the window for feeding and the window for sleeping. You will see that most of these conditions, okay, metabolic and other chronic diseases or risk factors, have responded favorably to time-restricted feeding or time-restricted eating. Okay, so this is a schematic ideal TRE intervention. Okay, and this intervention incorporates, of course, optimal sleep time as well as the appropriate duration or 10-hour TRE or time-restricted eating. So as represented in this schematic ideal TRE intervention, upon waking up, you avoid food for at least 1 hour after waking up. So this is where the window for feeding you have, and you can indulge with light to moderate outdoor exercises. Very important that 2 to 3 hours before bedtime, you avoid bright light and avoid calories because that will affect circadian rhythm, and the 8-hour time in bed. So very important in the recommendation that you use your time in bed as a guide to determine the best 10-hour eating window. So again, the window should start more than 1 hour after waking up and end more than 2 hours before bedtime. So make sure that you do not eat the 2 hours before bedtime. Okay, so this is just a summary of studies of time-restricted eating pattern interventions in human. So basically, it summarizes that the effect in weight loss is there, but not very consistent. And I'll show you the summary that we reviewed, particularly on TREs. So next is intermittent energy restriction. So the difference in intermittent energy restriction from TRE is that this involves eliminating or fasting or greatly reducing daily intake of food or caloric beverages intermittently. For example, 2 days a week or number of hours in a day. Okay, so simply put, intermittent fasting is periods of voluntary abstinence from food and drink. Okay, so however, there are different intermittent fasting regimens hypothesized to impact health outcomes. So you have the complete alternate day fasting. So this involves alternating fasting days, so no energy containing food or beverages, with eating days. You have the modified fasting regimen. You allow consumption of 20 to 25 of energy needs on scheduled fasting day. And this is the basis for the 5-2 diet. 5 eating days and 2 fasting days. So time-restricted feeding, we've discussed earlier, is sometimes also clumped to intermittent fasting. So there are religious fasting. There's Ramadan. That we're quite familiar with Ramadan among our Muslim brothers, wherein they eat when the sun, the first food intake is when the sun, before the sun rises. Okay, I think that's suhoor, and when the sun sets, that's when they break their fast, and that is iftar. So usually the fasting period is approximately 12 hours in length. And of course, there are other religious fasts that is characterized by intermittent fasting. Just to show you how important or how popular intermittent fasting is, I looked at Google Trends and tried to identify in the past 5 years searches for intermittent fasting in Google versus, for example, searches for the same time period for healthy diets. So as you can see, okay, as represented by blue, intermittent fasting has more searches now compared to healthy diet. Okay, And what is the rationale for intermittent fasting? So intermittent fasting basically flips the metabolic switch. So the body's preferential shift from utilization of glucose from glycogenolysis to fatty acid and fatty acid-derived ketones. So ketones appear to be the preferred fuel for brain and the body during periods of fasting and extended exercise. So you want to harness fat lipolysis or fatty acid oxidation. So this switch represents a shift from lipid synthesis and fat storage to mobilization of fat in the form of free fatty acid and ketones. So the switch occurs in the third phase of fasting when liver glycogen stores are depleted and adipose tissue lipolysis accelerated. So this is between 12 to 36 hours after cessation of food consumption. And this is, of course, dependent on liver glycogen content upon fasting and the individual's energy expenditure and physical activity during the fast. So this basically represents the cellular and molecular mechanisms underlying improved organ function and resistance to stress with intermittent metabolic switching. As you can see here, during periods of intermittent fasting, especially coupled with exercise, there is systemic and cellular adaptation to bioenergetic challenges. So there is more utilization of ketones, increased mitochondrial stress and resistance, decreased insulin that will eventually produce resistance of cells and other organs to stress. So that when you now couple this with periods of recovery, eating and sleeping, systemic and cellular adaptation to energy repletion. So there's now a switch from ketone to glucose. So there will be increased glucose, increased insulin. So this will favor cell growth and plasticity. So that the long-term adaptation is there will be resilience and disease resistance with this metabolic switching. Okay, so this is metabolic adaptation. What basically happens when you mobilize triglycerides and you digest or metabolize triglycerides to free fatty acids, as you can see here, they will be eventually utilized, okay, by the Krebs cycle, as products through acetoacetate and beta-hydroxybutyrate, which are your ketone, and your acetyl coenzyme A, CoA, will be a substrate for the Krebs cycle to produce eventual energy. Your free fatty acids likewise will trigger activation of several transcription factors. So this would include your cyclic AMP response element binding protein, or your Krebs and your nuclear and your PPAR alpha. Okay, and this factors result in the production and release of your FGF21. Okay, and this FGF21 will have favorable effects to the muscles, to the heart, as well as into the brain. So that eventually these effects, together with beta-hydroxybutyrate, that will now also act as a messenger. Okay, will have effects likewise to the muscle, to the heart, and to the brain. Thus, eventually, again, producing favorable effects. And this is due to intermittent fasting. So this is just to show you in a different representation, intermittent energy restriction. So this is total IER, so periods of fasting alternated with unrestricted eating, versus partial IER, in periods of partial energy restriction, about 25 to 85%, is alternated with unrestricted eating. You will see the effects for both rodents and humans with regards to adipose physiology, active energy, negative energy balance, stress resistance, etc. Okay, so you have better endpoints. So this is again representing the functional effects and major responses of various organs to intermittent fasting. So you have improved cognition in the brain, reduced blood pressure in the cardiovascular system, lipolysis for tissues, enhanced insulin sensitivity in the muscle, reduced inflammation in the gut, and liver glycogen depletion and elevation of ketone levels, and reduced inflammatory markers. So basically, there are 6 popular intermittent fasting schedules. So you may be more familiar with the 16-8 diet, the 5-2 method, alternate fasting, eat, stop, eat diet, the 14-10 diet, and the warrior diet. Okay? So the 16-8 is the more familiar intermittent fasting regimen. So usually involves fasting for about 16 hours. So that's why 16, and then 8-hour window for feeding. So for most people, this schedule means you're not eating anything after dinner. Okay? So and you also skip breakfast. So the first meal is, for example, here at it's around 12 noon, and then their last intake is by 8 p.m. Okay, so this is the 16-8 diet, and you do this every day of the week. The 5-2 diet, you basically have caloric restriction. Okay, um, 2 days in a week, and you eat normally during the 5 days. So in women, are supposed to have about 500 calories on fasting days, or about 600 calories for men in the 5-2 diet. So not completely fasting. You may have 500 or 600 calories. The alternate fasting, so you have eat normally, but alternately you have fasting periods. This is the alternate fasting. And the eat stop eat diet. So eat normally day 1, 24-hour fast for day 2, etc. And there is also the 14-10, which is basically a variation of the 16-8. So you just have a longer, longer window for eating. And the warrior diet. So the warrior diet has very little data on efficacy. So you basically eat small amount of vegetables and fruits, and you eat just around 4 p.m. One big meal, okay, in a day, and then you fast eventually. Okay, so the data for intermittent fasting, no, compared to time-restricted feeding, at least this is data from the American Heart Association, shows consistent changes in weight reduction. Okay, but overall, if you look at this different studies, most of the duration, okay, of intermittent fasting intervention is of short duration, 12 weeks, 8 weeks, and usually the numbers are not that big. The subjects are 74, 32 patients, etc. Okay, so again, duration is very short, okay, and very limited amount of patients. So this is just one recommendation with regards to how to incorporate intermittent fasting patterns in healthcare and practice. So you see a graded prescription on how to do time-restricted feeding. So 10-hour feeding periods for 5 days in a week, and eventually 8 hours, 6 hours, and eventually like that. So that examples of time-restricted feeding or the 5-2 intermittent fasting. So these are the things that you can actually try by month, okay, when you want time-restricted feeding. Okay, so luckily a year ago, I think this is 2020, we were able to come up with a Philippine consensus statement on the use of ketogenic diet and intermittent fasting diet on adults for weight reduction. This was published in the Philippine Journal of Internal Medicine. Happy to be part of this consensus statement together with my colleagues in the PSEDM, the PASOO, the PHA, of course, from nutrition and dietetics, and even lay people. As you can see here, the group adopted the modified Delphi technique, wherein 75% vote was determined to carry out the statements. So I will highlight intermittent fasting. So in this document, it was defined as an interventional strategy in which individuals are subjected to varying periods of fasting. So it approach to weight loss. IF is an approach to weight loss which involves short periods of substantial energy restriction interspersed with normal eating. So it is also called as intermittent energy restriction. So in the document, there are definitions of terms with regards to what alternate day fasting is, modified fasting regimen, time-restricted fasting, and periodic fasting. Okay, I will now go through the summary of the recommendations, particularly for intermittent fasting and not for keto. So number 1, for overweight or obese adults without established cardiovascular disease, Intermittent fasting, particularly alternate day fasting and modified fasting regimens, may be used as a weight loss strategy for 6 to 12 months, because most of the studies are basically on alternate day fasting and modified fasting regimens, with a very few studies on time-restricted feeding and periodic fasting diet. So when we reviewed the statement, this was primarily based on a meta-analysis of overweight or obese individuals using intermittent fasting compared to continuous energy restriction or no restriction for weight reduction. So it included mostly randomized controlled trials involving 400 patients, with duration of these studies for about 3 to 12 months. So that is why the recommendation is between 6 to 12 months also. There were varied methods of the IF across the studies, which included alternate day fasting, as I've said, and fasting for 2 days and up to 4 days per week. The meta-analysis showed that IF was more effective for weight reduction, achieving a weight loss of about 4.1 kilograms. However, there was no difference comparing IF to caloric energy restriction in weight reduction. So with both interventions achieving weight loss of approximately 7 kilograms. But still, for the consensus statement, it may be, it is somewhat recommended as a weight loss strategy for 6 to 12 months based on evidence. How about for adults with type 2 diabetes? So for adults with type 2 diabetes, intermittent fasting is not recommended for weight reduction for patients using insulin or insulin secretagogues like your sulfonylurea or glinides. IF is not recommended due to risk for hypoglycemia. And for adults with diabetes on insulin or insulin secretagogues, IF is not recommended for weight reduction. And we reviewed several studies, though very small studies, that support this statement. So there's a 2-week observational study involving 10 obese diabetic patients, showing that IF can significantly reduce weight by as much as 1.4 kilograms and even improves fasting and postprandial glucose. However, these are patients without previous ASCVD. Okay. Likewise, after 12 weeks, both diets showed a similar but also showed some significant reduction with regards to HbA1c. However, this smaller population also had episodes of hypoglycemia. So that is why this was the recommendation. Particularly for adults who are overweight or obese with established ASCVD, there's no clinical controlled trials to support the use of intermittent fasting for weight reduction. And for obese and overweight adults with established atherosclerotic cardiovascular disease, IF is not recommended for weight reduction. So again, for that recommendation, there's no available evidence for this population. You also have to remember that in the meta-analysis, intermittent fasting that ranges from 3 to 12 months among overweight and obese individuals, there were no serious adverse events reported by the authors. However, these are some of the reported minor physical and psychological effects during intermittent fasting. You have the headache, reduced energy, feeling cold, and constipation. So this is not completely benign with regards to effect. I'd like to highlight, on the other hand, a scientific statement from the American Heart Association. This was in 2017 on meal timing and frequency implications for cardiovascular disease prevention. So basically, they advocate what we call intentional approach to eating. So intentional approach to eating focuses on the timing and frequency of meals and snacks as the basis of a healthier lifestyle and improved risk factor management. So this includes that you understand the patient's frame of reference in how he or she may define meals and snacks. So a snack may be a meal to you, while a meal may be a snack to others. So recommend distributing calories over a defined period or portion of the day, so a window. Recommend eating a greater share of the total calorie intake earlier in the day to have positive effects on risk factors for heart disease and diabetes mellitus. They also want to promote consistent overnight fast period. Again, because of the circadian rhythm. Link eating episodes to influence subsequent energy intake. Example, place snacks strategically before meals that might be associated with overeating. Include intermittent fasting approaches as an option to have lower calorie intake and to reduce body weight. Use add-in eating episodes to introduce a wider variety of healthful foods and to displace less healthful foods. And use planned meals and snacks time throughout the day to help manage hunger and to achieve portion control. So these are recommendations from the American Heart Association. So hopefully I was able to achieve my objectives for today. And let me just summarize basically from the Philippine journal, from the consensus statement published in the Philippine Journal of Internal Medicine with regards to general advice for weight loss. Lose weight by eating well-balanced diet in appropriate amounts proportionate to your needs and at physiologic intervals coupled with regular and appropriate physical activity. And most importantly, consult your physician and registered nutritionist dietitian before engaging in any weight loss diet regimen. So with that, thank you very much. Be well and be safe.